Jozine Ter Maaten and Mike Gibson coming to you from ESC 2023, and we're talking about the PUSH-AHF trial, Natriuresis guided treatment in acute heart failure. Jozine, talk to us a little bit about what you found.
Yeah, thanks. As you all know, the treatment of acute heart failure has remained unchanged over the last 50 years. So we always use loop diuretics, but this one-size-fits-all approach falls short in a great number of patients. And recently it has been suggested that urinary sodium or natriuresis might be a better marker to assess response, but also as a marker to guide diuretic therapy. So this is what we studied in the PUSH-AHF trial. We studied both the effectiveness and the safety of a natriuresis-guided approach in patients with acute heart failure. This was a randomized,
So go ahead, describe the methodology. Yes.
Sure, yeah. So it was a pragmatic urinary sodium-based algorithm treatment that we used in patients with acute heart failure. They were randomized to two groups, so either natriuresis-guided therapy or standard of care. And we termed it a pragmatic trial, as all study assessments, but also randomization was incorporated in the electronic health record. So it made it very easy to execute, but also allowed us to swiftly enroll a generalizable acute heart failure population.
How many patients are we talking about here?
How many patients? 310 patients, so 150 in the natriuresis guided group and 160 in the standard of care group. And the study was powered for a dual primary endpoint of 24-hour natriuresis and a combined outcome endpoint of 180-day all-cause mortality and heart failure rehospitalization. And these rehospitalizations were adjudicated.
And what did you find?
Yeah, so we found that in patients in the natriuresis guided group, that natriuresis was indeed significantly increased in the first 24 hours. When we go to the second part of our dual primary endpoint, we did not observe a difference in 180-day all-cause mortality or heart failure rehospitalizations, but we did see a significantly lower number of in-hospital mortality in the natriuresis guided group. And we also saw that the effect of natriuresis-guided therapy was sustained in 48-hour natriuresis, but also 24 and 48-hour diuresis, suggesting that we are indeed able to better decongest these patients that we identify based on an insufficient response, so they're able to reach euvolemia probably earlier. Yeah.
So when they came in to be rehospitalized, did they get the natriuresis guided treatment again? So that was used consistently? No, is this the first time?
Yeah, it's just the first hospitalization. So the follow-up rehospitalizations, they weren't enrolled in the trial and they just went on to receive standard of care.
And when you talk about the mortality, the in-hospital mortality, was that during the first hospitalization or subsequent ones?
No, during the first hospitalization, and we saw that in the standard of care group, 14 patients died in the first hospitalization, and in the natriuresis group, this was only 2 patients. I should say this was not a pre-specified outcome, so it was something that we noticed because the Kaplan-Meier curves diverged very early and seemed to come together later on during follow-up. And this is, I think, something that we also know from other acute heart failure trials, that it's very difficult to improve the long-term outcomes if you only have a short intervention. So it was only the first 36 hours of the hospitalization. And I think we've seen in other trials as well that it's very hard to improve the long-term outcomes. And that's, I think, where the results of the STRONG-HF trial also come in, and the power and the value of up-titrating your guideline-directed medical therapy.
Well, I think you need to do the PUSH trial, where you keep doing this in every hospitalization and see if that makes a difference in outcomes. You're right; it's hard if you just do it once, but maybe as a strategy of repeating it, maybe you would see better outcomes. Well. Very interesting, Jozine. Thanks for sharing the data with us. Congratulations on a well-conducted trial. And thanks for joining us. And thanks to all of you for joining us here from ESC 2023.
Thank you.
Thanks. you.